Teeth on 4 is a revolutionary new technique whereby a whole arch of failing teeth is replaced with dental implants in just a single visit. With Teeth on 4 treatment, all the upper and lower teeth are replaced on just 4 implants. Advances in dental implant therapy now allows patients to benefit from fixed bridge work on the same day. This is a very successful and viable alternative to dentures and conventional implants. With Teeth on 4 treatment, the back implants are placed at a 45-degree angle, and this increases their strength and ability to anchor a fixed bridge using less implants.
Hi, good morning. My name is Bruno Silva. I'm one of the dentists at the Brighton Implant Clinic. Today I'm going to be talking to you about a case that we're going to be treating in our clinic. This patient came to see us with some problems. We're going to look at the problems before and what gave rise to get to this stage, and then also the treatment that we're going to be providing. And then hopefully towards the end of the day we'll be looking at some pictures and images of the treatment that's been carried out. So looking at this image over here, we've actually got a 3D X-ray image or scan that's been taken, and what we can see over here in this area is basically the upper teeth. And if one looks at this area, one can see that these teeth, especially on the upper left side, they've lost a lot of bone around the teeth. Now, our natural teeth are embedded within natural bone, and it's this natural bone that actually keeps our teeth secure and functioning well. Unfortunately, due to gum disease, this bone can be lost. So gum disease, it starts off maybe as an early sign, like with bleeding gums, but over a prolonged period of time, if left untreated, this bone will gradually shrink or become reduced, and over time the teeth that are supported within the bone become more unstable and start to become mobile. Usually by the stage that one sees teeth that are quite mobile, it's really quite bad news, because it means that the bone support that is holding the teeth in place has basically been reduced, and unfortunately the only thing that can be done, if all other measures, for example like gum treatments and periodontal treatments have been carried out, the only other solution is to actually remove the teeth. This patient has come to see us today seeking treatment for the teeth that are basically moving now, and we're looking to remove these problem teeth, and we're hoping to place implants on the same day. The treatment usually takes about 2 to 3 hours, and it's carried out under local anesthetic or intravenous sedation. The sedation basically helps the procedure to be more comfortable and for the patient to be generally asleep. So provided the implants are placed into good, healthy bone, we will be able to measure the stability of each implant. If the implants are adequately stable, and we'll be able to take some impressions after the surgery is complete, and we'll be able to make a fixed bridge that will be supported onto the implants on the same day. This bridge that is made is not the definitive or final bridge. It's actually just a provisional bridge, which is used for a minimum of 4 months. During this 4-month healing period, the patient will be using this bridge and will be basically able to function, eat and speak normally with fixed teeth. After 4 months, we'll be able to take into consideration all the good factors and good points of the provisional bridge, and we'll be able to even perfect some issues, for example color, shape and position of teeth. We'll be able to make the final definitive bridge. So the treatment that we're proposing, we're going to be placing a minimum of 4 implants. These 4 implants are going to be spread within the patient's own bone, so that we won't need to add any artificial bone or have to carry out any bone grafting. This procedure is called Teeth in a Day, or Teeth on 4. It's very important to note that this procedure is not suitable for all patients that would be requiring a full arch treatment. We have to carry out a very thorough assessment and ensure that the patient is indeed suitable for this type of treatment. In many cases, we have to remove teeth, and we have to wait for the bone to heal before implants can be placed. patient has now completed the treatment in the upper jaw. Essentially the surgery has been completed, and we've now completed the surgery in the lower jaw. So the upper jaw, the patient was very happy and he's come back to see us, and we can see that the treatment's been completed in the lower jaw. Again, 4 implants have been used for the teeth on 4, and one can see that he has both upper and lower provisional bridges in place at the moment. These bridges need to be in the mouth for a minimum of 4 months. During that 4 months, it will allow adequate healing between the implant, the titanium implant, and the bone tissue. And provided the implants fuse completely, or otherwise also we say osseointegrates with the jawbone, then we will assume the treatment to be successful from a surgery perspective. The final challenge will then be to take impressions for the definitive bridges, which are going to be used as a long-term restoration for both the upper and the lower. During the 4 months of healing, it's very important that the bridges are maintained properly, and by this we mean that the patient needs to ensure that cleaning underneath the bridge is properly carried out, because plaque accumulation or food debris can accumulate, and this needs to be adequately removed and cleaned by means of not only brushing, using superfloss, and very importantly a water jet device that basically irrigates fluid or an antiseptic mouthwash underneath the bridge. So there is a small space underneath the bridge that allows for thorough cleaning and rinsing underneath.
For more information, please feel free to contact Brighton Implant Clinic